Assalamu alaikum and hi everyone. I'm Dr. Mas Qureshi and today we are going to learn a few things about ECG, which stands for electrocardiogram. It plays an important role in the CVS or the cardiovascular system or module. So first I'm going to teach you how a normal ECG looks like. This is your P wave. This is your Q, this is your R, this is your S, and this is your T. P, Q, R, S, and T. So first, we are going to be talking about the P wave. So the P wave is really easy, and it shows you about the atrial contraction. What I mean by this is if you divide heart into 4 chambers, let's suppose heart is not a rectangle and is perfectly shaped, and this is your right side, this is your left side, this is your atria, this is your ventricles. Now, the atrial contraction would show P wave on the ECG. Now, in other words, they can use other terms like atria, contraction, atria, depolarization, or when the action potential of the atria reaches its peak. So you may face a lot of those scenarios, tricky scenarios, and they can ask you or test you on your USMLE or Fcps examination. So learn these and get yourself familiarize with these terms. So now the P wave indicates your atrial contraction, but how can you see if there is any pathology in this P wave? So normally we see this P wave and it is not tall, it is perfectly in shape. But what if you see a tall P wave? Just like the QRS complex, which is quite sharp, and it is just like this one. Or what if you see a bifid or M-shaped P wave? So these are one of the two pathologies which I'm going to tell you about. So first one is, imagine that you see a big tall guy. Imagine this one is really skinny, just like a candle. So he's tall first, and now this is a cartoon showing that what will you see on the in an ECG which shows a P wave and it is tall. When you see a P wave which is tall, you will know for sure that there is some enlargement in right atria, this one here, and this pathology is called P pulmonale. Now, what about if you see a big guy, a big chubby guy with fatty hands and fatty legs? So this is, in ECG terms, this is your bifid, and you see this in P wave when you have enlargement in your left atria. Now this is called your P mitral or mitral. I will call it mitral. I'm just getting E for just the facts. Now the P mitral can also be remembered through, see, this guy has a lot of mass and you have M in mitral here, so you can remember this through tricks, you know. Now let us step into another segment, which is this one here, the PR segment. The PR interval. There is a difference between the PR interval and the PR segment. But first, we are going to be talking about this one here, the PR interval. So let's talk about that one. So PR interval. Now the PR interval is basically start of the P wave, and it is the start of your Q wave. Now on ECG strips, you can see there are big squares and there are small squares in each big square. Now each small square is equal to 40 milliseconds, and the PR interval is approximately 180 millisecond to 220 millisecond. So we can say that it is between 3 to 5 small squares. So in short, if it is less than 3, it would be called short PR interval, or if it is more than 5, you can call it prolonged PR interval. So now you may ask, what are the causes of these two? So prolonged PR interval have some drugs causing them, some physiological, or you can get pathologies which cause them. So common drug which can cause prolonged PR interval is your beta blockers and calcium channel blockers. While there are pathologies like heart blocks which can cause prolonged PR intervals. Now you may ask that what about if the PR interval is reduced or shortened? How can you see that, or what causes this PR interval to get short? So you have pathologies like Wolf Parkinson White syndrome, or you can see in tachyarrhythmias when there is um, atrial depolarization and with much more speed. One more important thing which I missed here is that this PR interval here would probably show you the AV nodal delay. So it gives a lot of time for the ventricles to fill and then contract. So it is really important. Now, what about the PR segment? So in PR interval, we included or we said that there is the start of the P wave and the start of the Q wave. Here, we will take the ends of P, which means that you won't include P in it, but you will include the Q. What I mean by this is that if we draw a line between the PR segment and the PR interval having will have the P wave and will have the start of the Q wave, but in segment here you will have no P wave, but you will have the start of your QRS complex. Now it is the end, it shows the end of your atrial depolarization. What I'm talking about here is the PR segment is basically a segment between the end of the atrial depolarization and the start or the onset of your ventricular depolarization, or in short, ventricular contraction. In order to know the pathologies, you'll have to see that in PR interval. These are just an isoelectric lines. These PR segments are just an isoelectric lines, and you can only see the pathologies in PR interval. So I hope you guys learned something new and I made it easy for you guys. In the next videos, we are going to be talking about the QRS complex, ST segment, the T wave, and other waves which are really important. Hope you guys enjoyed, and if you haven't subscribed already, do hit that subscribe icon, hit the bell if you want to be part of our community, and follow us on our Facebook on MSQ Productions, and you can also become part of our community by joining our Telegram group where we solve those difficult MCQs with concepts. Get it? Got it? Good.